this is part of this Global Views of COVID-19 series that I've been doing, which is really interesting for me. I'm just fascinated to see how this is unfolding around the world. I guess that's a little bit of a silver lining, is the curiosity about it. And here we have today's map from Johns Hopkins and focused on Brazil. So this was from just a couple of hours ago. Okay, so to introduce myself quickly, and then we'll move into the other stuff. I'm Shane Carter. I'm the program coordinator for ORIAS. ORIAS is a little office at UC Berkeley that represents the area studies centers on campus that have federal funding. There are 8 of them. And so I do programming for K-12 and community college instructors to try to help you learn more about topics from around the world. So that could be world history, it could be literature, it could be art, etc. But also in this instance, of course, we're spreading into like epidemiology and science, etc. And so I put this together not because I'm expecting you to teach lessons about COVID-19, although of course you're welcome to, but just because you are important vectors of information in your classrooms, and the more educated you are, the better you'll be at your job. And I want to help you think about and understand this current moment in a global context rather than the local one that we're all experiencing. So I'm going to ask you to put something in the chat box in just a minute. And then after that, we're going to have our presentation from our speaker today, Elize Massard da Fonseca. Then we're going to do a Q&A, a quick closing poll. I would love it if you stick around for the closing poll, and then I'll just have one more slide about future resources if you want them. So I reached out to the Center for Latin America Studies here at UC Berkeley, who, if you look at the bottom of my slide, you'll notice their logo is there too. That's because they're co-sponsoring this. And I talked to the vice chair there and asked for some suggestions about people who might be able to speak to us about what's going on in Latin America. Of course, it's difficult to choose. There's so many different places and topics to look at. But I thought that Brazil might be an interesting place to look at, partly because of some of the mirror image issues and then some of the differences. I think there's some really interesting highlights in both the similarities and differences column. And so Julia there recommended Elize to me, and she has been incredibly kind and charitable in putting this together. And so as you see also, her area of expertise has to do with public administration and also connections to pharmaceutical, in this case regulation, but health industry policy you see, and also infectious diseases. So I think this is a good fit in terms of like the things that you're able to bring us and help us understand. Elize, thank you. So I'm going to turn it over to you. I'm going to stop sharing my screen so that you can share yours. And at the end of Elize's talk, then we'll move to Q&A, but you guys should feel free to put questions and answers in the chat box anytime.
I think you all can see, right?
Yep.
Yep. Okay. So thank you for inviting me to be here today, and thank you all for coming. I see we have a big audience. It's almost 30 attendants, and it's great to see everyone is also a teacher here. I teach undergrads and graduate students, and I think we have some connections somehow, and hope you are all doing well and safe at home. And this talk today, I'm gonna present some of the advancements and limitations of the Brazil's response to the COVID-19, and when possible, compare to what is happening in the US. And I see from the box in here that we have a lot of similarities in that sense. And you probably, some of you that are following the news, the international news, probably have heard about my president. He's very controversial and he's all over the news, international news. I was talking to colleagues in Portugal, and they have heard about Brazil already. So I'm gonna talk a little bit about this as well, and the controversies of the Brazilian response. First of all, the first case in Brazil appeared in São Paulo in February 25. It was a man returning from Italy, and most of the initial cases in Brazil, they came from abroad. They were middle class or upper middle class from uh, uh, returning from traveling abroad. And these initial cases, they were treated in private hospitals. Something that I think it's very important to understand the Brazil's case is that we have a public health system. So 75% of the population is covered by the public health care system, and 25% is private health insurance, probably very similar to what you have in the US. When you work, your company or your institution provide benefits, and one of these benefits is private health insurance. So at the moment, as the epidemic is spreading through communitary transmission, most of the population are getting treatment in the public healthcare system. And this is putting a lot of pressure in the healthcare system, and we see that we share some similar issues, such as the lack of personal protective equipment and some other things that I'm going to talk later on. Also, another important thing to understand what is happening in Brazil is that the regional governments and the health minister are the ones taking the leadership in responding to the epidemic. So although we saw the community transmission, the Minister of Health officially acknowledged community transmission in March 20, in March 14, around March 17, regional governments had already issued quarantines, and they closed commerce and all other non-essential services around some of these regions. So the role of the governors and the role of the health minister is something very important in Brazil. I'm going to talk about this later on, but just to start. Also, another important thing in Brazil is the size of the country. So Brazil is the largest country in Latin America. As you can see, we have different patterns of the epidemic in different regions of the country. Amazonas is one state that is very problematic at the moment. We have lots of cases, new cases. Ceará as well is another very important place as the COVID is spreading very fast. But mostly here, São Paulo and Rio de Janeiro, as you can see, the state of São Paulo here has almost 1/3 of the death in Brazil happens in São Paulo. So this is the epicenter of the epidemic. This was the first state that we saw a case of COVID, and also where we have the majority of death happening at the moment. These are data from yesterday. And this is very similar, I guess, to the US. You have a huge country, and the epidemic is behaving differently in each state, and probably the regional governments there, they also have different responses to what is happening. So moving on to the state, the capacity of the healthcare system in Brazil is also something very important, because the healthcare system, I think anywhere in the world, there is a health system that can deal with simultaneous cases of COVID. And Brazil is not different. So here we have São Paulo. As I said, half of the deaths are happening in São Paulo. The picture that you see above is a man in Manaus, the city of Manaus in Amazonas. This week we saw an article at the news saying that they are keeping dead bodies together with patients being treated, because they don't have places to put these people. The service is taking too long to remove this dead body, so they are keeping them together with patients that are being treated by treated to COVID. So São Paulo, Rio de Janeiro, Ceará, Pernambuco, and Amazonas, there are no beds available anymore. São Paulo and Rio, we still have, I think, 10% of the beds are available, but they are reaching full capacity very soon. We also see a lack of personal equipment in many states in Brazil. There is no imports available. You probably have heard, I don't know if you have heard about this, but Trump, he bought all the supplies from China, and any other country in the world, they cannot buy anything from China anymore because there is nothing available. And also we are seeing several field hospitals around different regions. The ones that you see in the picture below is in São Paulo. That is a soccer stadium that it was turned into a field hospitals, and we see that in several other states. In Brazil, massive testing, same as you said here, as you see in the US, in Brazil, it's not possible. It's not possible for two reasons. One, we don't have supply of testing. Second, we need the logistics to get tests to the labs, and then the labs must have capacity to assess all those samples. And we have three problems. We don't have tests, we don't have logistics to get testing to the labs, and then when they reach the lab, it's not possible to process everything at the same time. So there's an enormous underreporting in Brazil and enormous lab backlog of tests. So that's a huge problem in the country at the moment. Just moving on. So another important thing in Brazil is to understand the context where the crisis, the moment where the crisis hit Brazil. So we are coming from an economic crisis since 2015. The minister of the government wasn't willing to put any more funding into any sort of social care. It was not possible. That was a strategy. There was a strategy of economic austerity in the country at the moment. But the federal government was forced to invest $2 billion into the Ministry of Health to respond to the COVID-19. Also, we have a huge cash transfer program. I don't know if you heard about that, but that is something that Brazil is well known of for this comprehensive cash transfer program. So to respond to the COVID-19 and so people could stay at home during the quarantine, the government increased the beneficiaries of the cash transfer. And third, the government is also supporting informal workers. I think that might not very common in the US, but that is very common in Latin America. So there are several informal workers. They work in the streets. They sell some electronics and imported things in the streets, and they are not registered at all with any government program. So it's hard to reach them. So how do you reach them? This is probably something you can relate because I think the US is also giving financial support to workers, but it's very deep. But the problem here is how to reach them. Because they are not registered anywhere, and there's a lot of opportunistic behavior in that process. So anyone could just go to the government and say, I'm an informal worker and I want to receive money, and this is something they are trying to understand and to make the money reach the ones that are in need, really in need. As I said before, so the leadership of the Ministry of Health is something very important in the Brazilian response. The person in the picture was the former Minister of Health. He was the Minister of Health in Brazil until last Friday. So you can say, why he was fired last Friday, and you can think, whoa, he was fired because he wasn't doing a good job. No, it's the opposite. He was fired because he was doing a good job. But he was in conflict with the president's opinion, how to respond to COVID. And he was very close to the regional governments and governors. And the president wasn't very happy about that. And he thought that the health minister was going to run for election, and he was just trying to get attention. So it was something that created a tension between these two political actors. And another important thing that the health minister did was to increase transparencies of the actions that the health minister was taking. He was doing daily something happened here. Oh, okay, came back. So he was doing daily press conferences and explaining the actions of the Ministry of Health, everything, how the epidemic was behaving, and that was making the president very upset because he didn't want any political actors taking the scene in that process. And he started asking for him to stop doing these daily press conferences and becoming more aligned to what he was thinking in terms of response to the COVID-19. And I'm going to talk more about this now. So let's look at this in chronological order. So the first picture here, you have Bolsonaro, the president of Brazil, and Trump. They met in March 8th in Miami. And Bolsonaro, he's a big fan of Trump. When he came back to Brazil was in the beginning of the epidemic, and he was just mimicking and copying everything that Trump was saying in terms of responding to COVID, like we need to have chloroquine and stuff like that, so malaria drugs. So the next picture is the former health minister with the governor of São Paulo. Bolsonaro is a political opponent of the governor of São Paulo, and he didn't like this picture. His health minister sitting next to his political opponent, and that he was very jealous, and he gave several speeches and talks in the news complaining that they were together. And then we have this picture here. This is Bolsonaro Twitter. He uses similar strategies as Trump. He uses Twitter a lot to communicate with his constituencies. And this here is a protest. He was complaining, he was very against the quarantine and the social distancing measure that São Paulo and other state governments. So here is Pernambuco, Recife, Pernambuco. What these people they want to end quarantine and open the economy again. And he was very they were very against what the regional governments are doing. So the other picture here, we have a meeting, online meeting between the president and the 27 governors in Brazil. And this meeting was very controversial because he was complaining about what the regional governments were doing. He said he was the leader that had the power to issue quarantine in Brazil, and he got very angry with the governor of São Paulo, saying that he was using the epidemic to promote him politically. So this is the situation in Brazil. So we have a lack of coordination about what the president wants, what the governors, the state governors want, and what the health minister think it should be done to respond to the epidemic. So on one side, we have a political actor that is very similar to Trump. On the other side, we have political actors that are following the guidelines of the World Health Organization and evidence-based policies. And here we have This was an article that was published in the Washington Post, I think last week, April 14. And the editorial says Bolsonaro is one of the worst leaders in the world that is fighting COVID. He's trying to minimize the importance of the virus, and so they placed him as one of the worst. So you can see here, this picture is he's supporting chloroquine, the malaria drug, the same as Trump is doing to treat COVID. He says here, this is his slogan: Brazil cannot stop. Uh, we should not stop the economy and everything because of this little flu. And the picture below is Bolsonaro with the new health minister, the health minister that took power on Saturday, this last Saturday, because he replaced the one that was very popular and getting a lot of attention from the media to someone that he calls more technical. Is this new minister? He is not political affiliated. He's a doctor. The other one was also a doctor, but was someone um, that was affiliated with a political party. And this one is just a doctor, is someone that is willing to stay behind the scenes while the president promote his agenda. But I want to finish this story with a positive experiences in Brazil. So Brazil has several research institutes that are collaborating in the development of a new vaccine. This is one of the things that Brazil is known of in responding to infection disease such as AIDS, hepatitis. The health system in Brazil relies a lot on public laboratories that produce vaccines and medicines to the healthcare system. And this is not different in the case of COVID. So our scientists are also researching for a new vaccine and a new drug to treat this disease. As we can see, we are fighting the epidemic, but the leaders of this fight is the health sector bureaucrats and also regional governments that they are aligned with the World Health Organization guidelines and evidence-based policy. I was talking to Shane earlier today, and I think the situation in Brazil is not as worse as could be if we are just following the guidelines of our president, because we have this health sector bureaucrats and regional governments that are taking the leadership in the fight of the epidemic. But also we have some experience. One of the things that is worried the country at the moment is when the epidemic hit the favelas. So favelas are shanty towns, and the ones that you see here in the picture is Rocinha. Rocinha is one of the largest favelas in Latin America. The problem is you can see like people live in a small, we could call a studio. So we have entire families living in one bedroom apartment or house, and it's very difficult for them to keep social distance when you have only one room in your house. It's pretty much impossible to keep social distancing in that condition. And this is something that is worrying everyone here, but the government is taking longer to respond to this situation. And the young man that you see in the picture is my student, Pedro. He's an undergrad in public administration, and he created this initiative to respond to the crisis in the favelas in Rocinha, where people can donate and also teach. They are also teaching people living in these neighborhoods how to prevent COVID. They are teaching them the importance of washing your hands, of staying at home, of how can you get financial supply from the government, and so on and so forth. They are also providing food and other supplies. And this is an initiative that was created by someone living in the community. And there are several other initiatives by people living in these conditions. And this is something very positive, how this is creating innovations, and how the community is organizing to respond to that in the absence of the government. So if you want to check out, you can see his website here. It's in English as well. um, and this picture here, he gave an interview to a famous, it's called almost like CNN. Global News is almost like CNN. So he's very famous now. And that's it. Like, this is just a brief overview of Brazil. If you have any questions, we can discuss now, and I would love to hear what your city and state are doing, and if that is similar or not to what Brazil is doing.
That's great.
Thank you.
Thank you so much. I'm gonna move. Sorry.
Yes, the time. Is the time correct? Like,
yes, it's perfect. It's perfect. So I'm gonna move the screen back to just this. Sorry, we got a view of you drinking your glass of water, but it looked very refreshing. So for those of you who are on, why don't we take a moment for you to frame some questions and write them in the chat box. So it could be questions specifically just about Brazil. It could be questions asking to help delve a little bit more into the comparisons that were implicit there. Whatever you'd like, let's just give it a couple of minutes. And then I will take them mostly in order, although if I see one that looks like really foundational, I might jump ahead.
Yeah, Venezuela is a big opponent of my president. So they are in different political areas. So Bolsonaro is a conservative, populist, right-wing president, and Venezuela is a leftist. So he won't help Venezuela in any ways. Even the refugees that are crossing the border, he thinks that the health system should not take care of foreigners and especially refugees from Venezuela. The Amazon, what accounts for the growth, Amazon is a very tourist region. So there's a lot of tourists coming to Amazonia, and keeping social distance in that region, it has been challenging as well. The role of private sector, that is a good question and a controversial one, because there are some big business, they support Bolsonaro, so the president, and they also support the protests, some of them, not all of them. And I think these are the ones that are financing those protests. So we have, I have two answers here. One is some of these big businesses, they want the economy open again, and they don't care much about what will happen to the health of the population. And there is another side of the big business and firms and of the economy. They are supporting quarantine and supporting their employees. Again, Catherine Main, that's a very interesting question that has the behavior of Bolsonaro. Can I read, or should you read?
I'm fine. If you want to read, go ahead. I'm not going to stop you. But if you get, I'm making copies of them and separating them out. So if people enter a lot and they run off the screen, it's easy. So go ahead. I think I appreciate how quickly you're going through them too. It's nice.
Yeah, the behavior, those are great questions. And if that is affecting his popularity, the behavior of Bolsonaro compared to regional leaders, and if this affected his popularity for a moment of time, yes. But then he uses very similar strategies as Trump, and I think this is something that we need to study more, the effects of Twitter on social media, on the preferences of the population, because as he started to appear a lot in social media and complain about what the regional governments are doing and stimulate those protests, his popularity is increasing. And that is interesting. And when you look at the opinion polls, the population, they support social distance measures. 75% of the population in Brazil are in favor of social distancing measures. So it's a paradox. Um, but he's not very popular. His popularity is increasing, but just a little bit, not that much. Um, yes, the people in Brazil are divided as the leaders are. We have a big polarization in the moment, same as in the US, I guess. But we don't have an organized, we have multiple political parties. It's not just Democrats and Republicans. So uh, division is not organized in terms of political parties, but in terms of right and left wing supporters. And
I want to just interrupt for a second
okay.
with regard to that, because one of the things that came out of the conference at UC Berkeley about sort of right-wing movement and populist movements around the world that I thought was interesting is I was interested in understanding that in Brazil, the support for the right versus left does not map onto like racial identities in quite the same way it does in the United States. And so I think that that's an important thing. Like when people get the slide deck, to go back and look at the picture of the protest, because racially, like phenotypically, the group of people that you imagine protesting in favor of Donald Trump here is not the same as that group of people in Sao Paulo. And so I think, or that wasn't in Sao Paulo, but it's not. And so I just think for an American teacher, perceptually, to be aware that that comparison needs to be complicated a little bit.
Yeah, yes. Also, every time we talk about race in Brazil, we also use variables such as education and income, because those are very connected. And yeah, so it's not as simple, that relationship. Um,
I think your next question is the one that says, I'm interested to hear more, because you asked about whether they're divided. I'm interested to hear more about what is being done with the situation in the favelas. Is additional housing being offered to families there so social distancing is more possible?
Yeah, that's a good question. Yes, they are offering hotels. So some of the regional governments, because that's a decision of the regional and city governments. We have 3 tiers of government, and all the 3 are elected. So that complicates things a little bit. So the city of Rio is offering hotels and transforming schools into housing. So elderly and people at risk could use those places, and they offer meals, they offer TV. You also have TV, air conditioner, and things like that. They are trying to get this population at risk out of the favelas. The situation for teachers, that is a good question as well, because we don't have access. Most of our students don't have access to computers. They watch their lectures on a cell phone. So, including the young man that I show you here, Pedro, he doesn't have a computer. He watches his lectures on his cell phone, and we donated our colleagues. We donated a computer so he could use a computer to attend lectures. But that's a problem. They do have internet connection, because this is something that the city, at least in Rio, is trying to um, uh, include in all neighborhoods in the city is internet connection, but they don't have access to computers. So I heard that some city governments, they bought tablets so the students could use that too, but not everyone. Some of the schools, they are giving vacations so the students can stay at home and then they will come back later. Um,
Wait, can you just pause for a second and say, where are you in your school year? Does Brazil also run from like September to June like we do, or is your school year
No,
timed differently?
we start in March.
Okay, so this
And
is the beginning of your school year.
this is the beginning of the year. Yeah, the academic year. Yes, it's different. Are they also conducting distance learning? Yeah, some of them are doing distance learning, the ones that can't do that. So another thing that there's a question here about Tima Burgess, how the communities are dealing with the lack of government engagement in the early stages of the virus. This is something that I didn't mention here in my talk, but the drug dealers, they are also forcing people into social distancing measure in quarantine. And I was talking to a student that is studying the favelas and services offered in the favelas, and we agreed that we could call this coercive social distancing measures, because when you have, the narco traffic is a parallel power in the favelas. So they run the favelas. So if they are saying people should stay at home, they will stay at home. So they won't go anywhere. So this is happening in some of the favelas in Rio, but not all of them.
So that's almost like the narco traffickers are like the governors or other local governments.
Yes.
They also are differing in their policies with regard to
Yes.
what they're going to enforce.
Yes.
Yeah. Okay.
Yeah. I think we need to study that, because they also offer social support to people living in the favelas. This is something that we know a lot, but seeing them acting in the COVID response is something unusual. And yeah, here new reports of gangs enforcing curfews. Yes, that is happening.
The next question is wondering how the demographics compare country to country. Wondering about like most mortalities in Sao Paulo.
Yeah.
Wait, I'm trying to. So
Yeah,
I guess how does that compare in terms of the mortalities in Sao Paulo, New York, densely populated cities, but also in the US, African Americans have a higher mortality rate. Also, I think Latino Americans have a higher mortality rate than other groups. So is there a demographic, is there a similarity like that, or is that information known?
No, there are similarities. I don't have the numbers here. This website that I use it to bring the graphs. They also have information by demographic, by density of the population, and for instance, in Ceará, it's not as dense as São Paulo, but the epidemic is also increasing faster than in São Paulo somehow. And this is something important. I don't have the data here as well.
But that that graph, the link to the graph is in your talk, right? Is it in the?
No, it's a website called Our World in Data, something in Our World.
Okay. I'll find it.
It's very interesting to use as a teacher as well, because you have information about different things, not just COVID. Everything that you want in Our World in numbers, they have there. So
okay. All right. I'll make sure I include the link to that in the follow-up stuff. Okay. Okay.
Yeah.
I think the next one is, does Brazil have much, this is interesting, especially thinking about Zika before. Does Brazil have much prior experience with dangerous viruses? And has that affected the education of the public, or is this really a new experience?
Yeah, no, Brazil has experience. For example, a recent epidemic was the Zika virus, a virus that was affecting, it's transmitted by mosquito, and it affected pregnant women, and babies were born with disabilities and physical disabilities and mental disabilities. And this is something that, but the HIV and AIDS as well, hepatitis, the country has been successful in dealing with this crisis, but an influenza at that scale, I think nobody in the world was prepared, apart from South Korea, Taiwan, and China that had experience with the SARS in the past. Countries that that never experienced an influenza on that scale, I think they were not prepared for that.
I think also it's worth noting, right, because Brazil is in part of the world that does not have seasonal influenza like we do, right, because of its location closer to the tropics.
Yes, yeah, we have other kinds of tropical disease, malaria, yellow fever, but those are very localized in next to tropical forests. It's not a urban issue at the moment, at least.
So, okay. So I think the next question is, with this difference of how to attack the issue of the spread, how has this affected the actual curve of the disease? I think what this person is asking is, given like what Bolsonaro has done, has this affected the actual spread or experience of the disease in Brazil?
That's a good question. Well, when he stimulates protests, that can increase. It didn't affect because you are not allowed to go out in the streets. So the social distance is enforced by regional governments. But those small protests, we hear that some of the people attending those protests, they got COVID. So it's hard to tell in a larger scale, but at the moment, I don't think so, because like I said, there are other authorities mandating social distances and other measures.
Got it. So it sounds like what you're saying is the practice is still much closer to the social distancing that's being maintained, and the shelter at home that's being maintained in most of the US at this point, but the rhetoric is different. Okay, so the next question here, thank you, is are Indigenous people more at risk, or do they have less access to healthcare?
Yeah, last week we heard about one case of COVID in indigenous population. Probably it was brought to them by someone that was, I don't know, bringing food or something like that, or doing some, I don't know. They have connection with external world. Some of the isolated tribes, probably someone that was there to give some sort of health a system or something like that. It brought the epidemic to them, and
so it sounds like there's not enough. There's just not numbers at this point among those more isolated populations.
It's small, but it's something that we are looking into because of this one case. It's hard to tell. Because everything we read about this is in the news yet. We don't have a lot of studies, but I heard about this one case of this one young man that got COVID, and he and I don't know, he didn't survive, and so this is something that the government is also dealing with.
Okay, I think the next question is, and I think we have two more and then possibly my last one, but I can look up my last one. One is there a chance that a more left government will get back into place? I think this means in the presidency, due to all of the controversy over Bolsonaro's response to this disease.
Well, I made the same question to a colleague of mine that is political scientist in the US. I asked him if there was a chance that Trump would win the election because of the epidemic. Well, all the polls, all the models at the moment say he still has chance. But it's hard to tell. His support, his constituency is very localized. It's very small. It's like 30% of the population. It depends on who will run against him as well. He made it to the government because because most of the population didn't want to vote for the leftist politician. So he was the alternative.
Mm.
It depends on, again, who will run.
And when is that election? The next
Two,
one?
two, 2022.
Okay, so quite a bit
2
distant
years
from
from
ours.
now, yeah.
Okay. And so we have two more here, actually. One is, I'm interested in knowing if the scientists and doctors of Brazil are able to get accurate information out to the public regarding the virus. So I think that's a question about freedom of the press and also their
Yeah.
platforms.
Oh, there you go. Our World in Data,
Yeah,
the
exactly.
website. Yeah.
Catherine edited.
Yeah, they are. They are, and the news is helping a lot in that sense. I see a lot of scientists talking about this, how the media is helping to spread the word, and to inform the population about what we should do in terms of social distance, how to wash your hand when you come back from the supermarket. What should you do? Should you wash your shoes? What do you do? Everything. They are informing there's a lot of coverage around this, and radio, TV station, and I think this is helping a lot as well. I think this is an important element of the Brazilian response.
So that sounds similar to her. And then the last one is, in the US, we have issues with COVID-19 in long-term care facilities and prisons. Is this similar in Brazil, or is Brazil doing a better job with that than the US is doing?
I think, well, that is the unseen population in every country. So this is an issue. There's a lot of, they are trying to release some of the prisoners that are that didn't commit any sort of they committed minor crimes, so they're releasing this, but there's still a huge problem of COVID. I read something that is very tragic that is happening in some of the prisons here. I don't know what the US is doing if you are isolating the cases at risk. But in Brazil, there is no way you can isolate prisoners because they it's an overpopulated. Almost all the prisons here are overpopulated.
We have the same situation.
Yeah.
Yeah.
Oh, I think that
and then that was the last one. I just asked a question, which was a little bit, I mean, you don't need to answer that, but I want to recommend for the people who are listening. One of the things that you've been hearing on the news is about how as the weather gets warmer and as we move into summer, that may well change the trajectory of transmission of the virus. And I just want to call your attention to the fact that Brazil is currently, many parts of Brazil currently have warmer weather than we do. And so one of the things is, and so it might be interesting to just kind of look at the weather maps for these places over that and see, we had another speaker earlier who was talking about, you know, the overlay of population density and warmer weather, and that maybe the warmer weather does slow the transmission because the virus doesn't survive as long on surfaces, but that the population density might increase the spreading. So obviously different parts of Brazil have different levels of density as well. But I just think it's interesting when we hear from people in places that have warmer weather than we do right now about what's going on. Anyway, I want to say thank you. Is there anything else that you haven't had a chance to add, Elize, that you wanted to say?
Yeah, I just want to conclude here. I want to finish replying the question about demographics.
Oh, I'm sorry.
Yeah, just we don't have a lot of data on that yet because I think there's 2 regional governments that release information about race, gender, things like that. Most of the data that we have on COVID at the moment, they are just who lives and dies, who survives, and who, we don't have a lot of detailed information at the moment. This is something that we are pressuring regional governments to release information on that. Data on the favela, this is something that my student Pedro, he is also organizing information about that in the favelas in Rio. So if you access his Facebook and website, you can find information about COVID in favelas, because his team is collecting information about that. And that's it. I want to thank you everyone for their brilliant questions. It's always great to speak to um, uh, uh, people from different contexts than mine, and learn about what is happening in your country as well. And thank you all for listening me, and thank you, Shen, for inviting me.
Yeah.
I hope that was useful somehow.
I think this was great. Thank you so much. It's been
Yeah,
really helpful, especially the comparative aspect. All right. I think that's it. I'll be in
yeah.
touch, Elize, by email, and everyone else I will send a follow-up to. I'll send a follow-up to all of you. Okay.
Thank you.
Thank you.
Thank you
Have a
very
good
much.
night.